My name is Matthew Hollis here at the International Institute of Natural Wellness Education. We recently had a question come in from one of our out-of-country associates that was asking specifically on manual therapies for temporomandibular joint dysfunction. Before I demonstrate a few things that can be done at home, I wanted to explain TMJ or TMD, as it's referred to, or temporomandibular joint dysfunction, can be caused by many things. So before considering any manual therapies, talk with your primary health care provider to ensure that these type of therapies would be useful for your specific condition. It can often be caused, there's probably one primary reason that causes TMJ or TMD. However, there is a lot of variables that can enter into it. Anatomical conditions based on injury development or genetics can be a precursor to that epigenetic release of the TMJ manifestation. But probably the most common reason that we see for this is any psychological or emotional conditions that cause an imbalance in the autonomic nervous system. As we've talked before, the autonomic nervous system is that part of your body that maintains and regulates all of the systems in the body that you are not cognizant of or are not manually doing yourself. So when we look at that, there is the side of that, the sympathetic tones of the autonomic nervous system that are commonly called the fight or flight or stress response, that are really what's tied to this condition in many cases. It's caused from being in an emotional or psychological state, and when you're perceiving things around you as in that fight or flight or stress response that causes this feeling of consistent anxiety. And the result is that you'll end up spending a lot of time clenching that jaw. And when you look at this temporomandibular joint, there are very small ligaments and tendons that keep it in alignment. And when you spend oftentimes at nighttime or other times keeping that jaw clenched, those ligaments and tendons begin to lock into that tightened state. So what we're demonstrating here, I should not refer to it as a treatment. It is not really a treatment as much as it is some exercises that allow you to release and to stretch those ligaments and tendons so that if there is not any other anatomical imbalance, the body can start realigning so you don't have that tightness and pain that is associated with this joint dysfunction. So what we're going to look at here, I want to demonstrate. I'm going to have you open your mouth halfway. And you can feel right in here, you'll feel this bone coming around, and right back here you can feel, with two fingers is usually the easiest way. So have them open your mouth all the way, and then close it. And you'll feel a hinge point right back here at that temporomandibular joint. And it feels like it goes around, and you can kind of feel a high side with a bone right here, kind of comes to that joint, and then down on the low side. So what you're going to do, you would have her open her mouth about halfway. Now, oftentimes manual therapists, what they'll do is they'll stabilize this joint and they'll apply a very light oscillating movement right here to this lower mandible on the opposite side with the heel of their hand. This is not one I recommend unless you're very comfortable doing manual therapies, because oftentimes people will extend and they'll push that beyond just the medial to where you're moving lateral on this side. So, but that is a common one, is stabilizing and just small oscillating. Then close your jaw, open again, and we do the same thing on this side. What we're doing here, we're not trying to adjust or move that jaw, we're just providing a little oscillation so that it will start to loosen those muscles. So if someone is wanting to do that on themselves, they would reach these fingers up and have them close their jaw, and then open it again. And when they open it all the way, they'll often feel this hinge point. It'll stick out, and they'll put a finger right on either side of it. Okay, close your jaw. Now what we really want to do is we want to loosen these ligaments and tendons in that complex. So there's several ways they can work their fingers, where one of them is stabilizing and the other is stretching, almost like you're ironing out. And you continue down that jawbone line with those fingers, kind of ironing out. Okay? They can also use those fingers on that hinge point, stabilize it, bring their opposing hand, open their jaw halfway. I rarely recommend someone that is doing it at home using the heel of their hand for this because, again, of overpressure. So I would usually have them use their fingertips and tell them we're just kind of trying to oscillate that jaw just a little. You're not trying to move it. You want to loosen these ligaments, and then have them do the opposite side. And roll these fingers down, and just ever so slightly you're going to move towards this hand, so you're moving this in line. Okay, now close your jaw and open. I can already feel that a little looser. The other common one is to take this hand. We showed you how to iron out. Now we're going to work the upper line and the lower line, so you're going to do in small oscillative movements. And your fingers, you can do it one at a time, or if you're doing two fingers, they continue to widen out as you follow this line that comes around and this line that follows this mandible. And so the motion you're looking for is this type of motion. It takes a little practice to do it on yourself, but you see how your fingers are widening out. I'm doing a gliding movement across the line of those bones just to loosen it. Okay, close your jaw. We do the same on this side. Have them open their jaw about halfway. Go ahead and open your jaw halfway. And as you can see, we find that and we just glide out. Just glide it out. If you feel any tension or a knot, you can always just take your finger. Remember that what we're dealing with here is a very small muscles in comparison to if you were rubbing somebody's shoulders or arms or hands. We're just doing light movements, just working it in little circles. This was a little tighter, so I'm just doing little circular movements ever so lightly. Okay, close your jaw, open all the way. Okay, now I feel a little on this lower side, so you can almost see in the camera that when the jaw's open, you'll have this lateral protuberance that sticks right here. That's the hinge point we're talking about. So in some cases, you actually have them open the jaw all the way, and you work around this point. Did you feel that kind of relax? Okay, and I'm going to roll on this side, same thing, just working. So you'll notice it's right up here at this, right from your ear here, and you just work that around. And then you're going to slide it down, slide it down, slide it down. Okay, close the jaw. All right. Now when their jaw is in a closed position, all those muscles are a little looser, so when the jaw is all the way closed, that isn't the ideal point to work this actual hinge point. But if I come down here, follow this down to where it meets the jaw line, or the upper jaw here, and you're having your teeth right here. Right at that point there, you can kind of rub underneath when the jaw's closed. Let me turn that a little to the side for you. You can see you rub right along that line, and what we're doing there is this one needs to be done with the jaw in a closed position, but we're just stretching. You can even do some gliding stretches right along that. Come around on this side and do the same. Gliding stretches. Again, this would be what you would do on yourself, so you'll just follow, and can you feel how you can almost push up under? Mm-hmm. Feel like you're going up under, and you're just gliding those muscles down, just stretching them out. Because they are small amounts, this is something you want to do constant or do all day long. Sometimes we'll run into that where people are constantly trying to rub it. You want to loosen it and let it be, and can maybe do that at the most once a day. Okay, so now I'm going to have you bring your hands up here so you can feel that hinge point. Go ahead and open your jaw and close. Can you feel how it's a little looser? Mm-hmm. There's still a little, this isn't the type of thing, again, because we're not manipulating in any way the joint itself. What we're trying to do is correct the long-term problem. There is therapists that are very skilled, be it a chiropractor, an osteopath, a napropath, that would be able to manually place that joint. That's not what we're trying to do here. But even in that instance where the joint is manually placed in place, if we don't correct this tightness, it will be pulled back out. So what we're showing you here is a way to start to loosen that temporomandibular joint so that if there is no other anatomical considerations that your healthcare provider has indicated, if it is purely a result of an imbalance in the autonomic nervous system, or that commonly referred to as fight or flight response reaction, then something along these lines will help limit or reduce the noticeability of that. The other side to it that we always want to educate people on is if it is coming from that imbalance in the autonomic nervous system, there's no substitute for addressing that directly. So we would teach good deep breathing exercises, teach exercise and other tools to help bring that autonomic nervous system into balance. The one most commonly that we'll use for this particular condition is that before bed deep breathing exercise that helps put somebody in that balance or even into the parasympathetic relaxation response, so that when they go to sleep they don't have that clenching effect. Now I'm going to have you just clench your jaw for me. I don't know if you can see that. Relax your jaw. Okay, one more time. Clench. You can kind of see there on camera, and relax. Even though her jaw isn't moving, one more time, tighten it. You can feel all of this muscles in this complex activate when she clenches that jaw, even though it hasn't changed the mobility or the positioning of the jaw in any way. That's what we're trying to limit when we're talking about a condition that's been either compounded or a direct result of stress. And so utilizing breathing techniques, other meditative techniques before you go to bed, so that when you go to bed you're not tightening that jaw all night long, is a real crucial piece. And then of course every other technique and tool that is available for learning to balance stress in your life, so that you don't have the conditions that are a direct result of stress. So consider that. As always, I want to remind you to always consult your healthcare provider before doing any manual therapies on yourself or any manual stretching. I hope this is useful. Thank you for your time.